Welcome, everybody, to the Kokua Council Legislative Priority Forum. This is part 2. We have a part 3 coming up on November 22nd. We'll talk about that later. Today, we have a few special guests with us who are going to present their legislative priority or their legislative priorities, depending on the person presenting. So as you know, Kokua Council, folks have generally been here before. This is one of the oldest nonprofit advocacies for Kupuna in Hawaii, been around since the 70s. I don't have the actual 70 date, but we've been around a long time. And we've done a lot of presentations, forums that have been just very, very interesting. This one kind of focuses on, it's part 2 because we're focusing on the legislative priorities that we're going to focus on for the next legislative session. And we were asked in the Kupuna caucus to actually start a little bit earlier this year on this focus. Generally, we do this in November, but to actually prioritize what we want to be working on in the next year and try to write things in a way that are passable. So that's how we were challenged in our Kupuna caucus, and that's what we've been doing. So this is part 2. First one, we had several people present a lot of just remarkable things that we'd like to pass everything. And we're just kind of narrowing it down right now. So without further ado, what I'd like to do is start with Caroline Cadirao, who is the Director of the Executive Office on Aging, and she's got an interesting proposal that she's been kind of talking about, and we'd love to get it out to our community here. And what we're going to do is she's going to spend a little bit of time talking about it. If you have some questions, go ahead and we'll ask them. We'll ask a few of them of her as we're going along, right? And then we'll move on to the next presenter. And just so you know who we have presenting after Caroline is going to be Samantha Trad from Compassion and Choice. She's the Senior Campaign Director for California and Hawaii. And then we have Ian Ross from Alzheimer's Association. So Hawaii Aloha Chapter. He's the Public Policy and Advocacy Manager. And then Gary Simon, President of AARP, is that your title? Is going to also present what they're actually focusing on. And so we're going to get some really interesting stuff out there. And we have a great audience here, so I know we're going to have some good questions for them as well. So each person will spend about 15 or 20 minutes on their presentation, roughly. And then we'll have our questions. And gosh, I think at the end, we'll have some pretty good ideas. So Caroline, if you'd like to start us out, I'd really appreciate it. Thank you.
Thank you so much, Rick, for having me today. And it's so good to see everyone. I am going to share my screen. Okay. Are you seeing the full screen?
Yep, got the full screen. Perfect. It looks good.
Okay. Let me just bring up this. Well, I'd like to, first of all, thank you so much for having me today. We have a new proposal that we have sent up to the governor for consideration. And it's basically the proposal that we're proposing is to combine our Kupuna Caregiver program with the Kupuna Care program. And what I'm going to do is I'm going to take a step back. I'm going to review both programs with you, explain how people get into long-term services and supports, and then explain the justification, the whys behind why we're proposing these changes at this time. So I'll go ahead and get started. Okay, so our initial program is the Kupuna Care program. This program was started in they started planning for it around 1996, but it was enacted in 2000. And the goal of Kupuna Care program is to keep older adults living at home with long-term services and supports to age in place. So again, our goal is to keep people at home, keep them out of institutions for as long as possible. There is always the need for institutional care, depending on where you are within the life spectrum and whatever your needs are in the community. But our goal is really to focus in on keeping people at home in their community where they are comfortable for as long as possible. And that is, you would find that in the Hawaii Revised Statutes under section 34917. Our Kupuna Caregiver program, newer program, our infant program, that program's goal is to really keep working caregivers gainfully employed. And that's by supporting caregivers with services so that they can continue to support their loved ones at home. Now, this law was enacted in 2017, and you'll find that in the Hawaii Revised Statutes, Section 34918. Now, both programs provide the same set of services. The difference, again, is the goal. What are we trying to achieve with this? And one of the questions that came to me earlier, too, was how do individuals become participants in these programs, whether it's the older adult through Kupuna Care or the caregiver through the Kupuna Caregiver program. And that's where our Aging and Disability Resource Center comes into play. So our area agencies on aging within each of the counties operate the Aging and Disability Resource Center. And for lack of a better term, the ADRC is really your portal to receiving long-term services and supports, because when you approach the ADRC, when you call, get an appointment to have someone come out and do an assessment, whether it's in person or over the phone, they do a holistic assessment of what your needs are. So, they'll start off with talking story, why are you calling today? How may I help you? We have a standardized assessment that everyone goes through that to determine if they're eligible for which programs, and then decide, looking holistically, how we can support both the Kupuna and the caregivers with both publicly funded services and supports, if that fits, with their natural supports, and also, if they have the ability, paid services. So the process to getting any services through our aging network is really to call the Aging and Disability Resource Center, go through the assessment, and discuss what are your goals, what are you trying to achieve by getting services and supports, and then we walk through that, and it's holistic for each individual, and then we determine what the goals are and how we can meet those goals with services and supports. So part of our the concept that we're proposing to the administration is incorporating the Caregivers program into Kupuna Care. And this is really to enhance the program, not to get rid of the program. And what I mean by that is, what we've done is, in looking at both programs, really taking the good components of the Caregivers program, incorporating it into Kupuna Care, again, enriching and enhancing that experience. So we're changing Kupuna Care to now have the dual focus, both the older adults and the caregivers. So that's one of the changes. Again, providing that array of services and supports to meet that holistic and comprehensive needs of both the older adults and their caregivers. Again, remember, these are the same set of services in both programs, so having it in one area would be best. It really does provide that safety net for both programs by combining it into one. Programmatically, behind the scenes, it eliminates confusion out in the community, but it also creates efficiencies in how we administer both the programs in a combined setting, because now we'll have the opportunity of utilizing various funding streams to support both the older adult and the caregiver. So that is the concept that we're proposing. And we're also adding in a caregiver support services. That's something that currently isn't in our Kupuna Care program, but that we're going to include. And that would be things such as, and we have these out in the community, but we're trying to incorporate it into Kupuna Care. So when we're looking at Kupuna Care holistically, this will be part of the services and supports that we could offer individuals. So things such as education and training, counseling for caregivers, and things like that, that would really support the caregiver in their need to care for their loved ones. So that's an addition, an enhancement to the Kupuna Care program that we're proposing. And again, when we look at this, and I'm going to end with this slide because I love this slide. It just shows, you know, people caring for their loved ones. But, you know, we always talk about having a holistic approach in how we service individuals, really taking the individual, the family, the caregiver from that point of view, where they're at that point in time, being holistic in our approach. We want to do that administratively too with our programs. So for us, by combining the programs, enhancing Kupuna Care, we feel that this it will streamline services, it will eliminate some of the duplication, and it also will help to really enhance and also to be efficient in the use of our resources, and also the way we assess and support individuals. So that's, I think, the key takeaway I'd like you to all to think about when we're talking about combining the programs. It's really, again, and I keep saying this, it's to enhance and to really increase services and supports to people out in the community. But what I'd like to do, Rick, is I would like to turn it back over to you to see, and I'll stop sharing so I can bring all of you back up on the screen. If there were any questions that anyone may have about the program, I'd be happy to answer any questions.
I think Lila left a question, and then if you don't cover it, I have a small additional question.
Great. Okay.
And then I see Ian has one as well.
Too.
Yeah, and I certainly can have a few.
Okay.
Rick,
Go ahead.
you wanna ask Lila's question? I didn't write it down.
I don't think I have Lila's.
She shared with us earlier about how to
Yeah,
get into the
Oh,
program.
that's one. What was the question again, Caroline? I forget.
I remember it was, how do individuals get into the program? How are they selected? And it's basically, we do have eligibility criteria. I'm sorry, I didn't get into the details of that. But again, it's through calling the Aging and Disability Resource Center, going through the holistic assessment. We'll determine eligibility based on the assessment, and then look at what's possible through our publicly funded services and supports to get them to address their needs.
I have a short question. One is, it sounds good to me, and then my question actually comes as a volunteer director for Kokua Council, and not as a employee of Hawaii Meals on Wheels. But I disclose that because there might be a conflict of interest. If you don't like my question, you have to blame Kokua Council and not Hawaii Meals on Wheels. So my understanding here is that the ADRC is going to be screening and qualifying the clients for each of these programs. And that sounds good, because I think there was a problem before with Oahu's EAD doing it. The question I have is that Kupuna Caregivers before had a separate budget because it didn't cost the taxpayer more. In fact, it kept the working taxpayer on the job, and in fact, it wasn't a resource drain, or it didn't tax the resources. So, is your concept for Kupuna Caregiver to be an extra additional fundings from Kupuna Care?
That's a good question, Doug. So what we've done is we are asking for additional funding. That's one of my asks in my budget request to the Department of Health. So that's gone to Department of Health, and it's up there right now. The beauty of having it combined is that if we don't receive additional funding, right now our Kupuna Care allocation annually is $9 million. If we don't receive the funds, we still have our Kupuna Care monies that can support on both ends of the spectrum. And that's kind of the beauty of combining it too, is that we can leverage resources.
Okay, that sounds good. And you'll let us know how we can help you with that ask.
Oh, thank you.
That's all I have.
Thanks.
And then, Ian, what's your question?
Thank you very much, Rick. Caroline, these are questions that I've asked you before, but I want to check in on the status of them as they're important to the Alzheimer's Association. Two-part, very similar. The first is, what's the status on the additional data you want to track from this sort of combined program in terms of data points that might help inform future programs or changes? And the second one, really related to it, is will there be a consistent system of wait lists? Because I know legislators often ask about wait lists, but my understanding is most of the counties don't really do a wait list for Kupuna caregivers currently. And that's kind of been like a inaccurate data point where legislators are like, well, no one's on a wait list, but there's not really a wait list in most of the circumstances. And so will one be instituted? Thank you very much.
Thanks, Ian. Okay, to your first one, we've been talking, we haven't finalized we'll continue to collect the data that we are collecting. I think the one point that we're still grappling with was our burden scale that we had first instigated when we put the Kupuna caregiver program into place. So that's one thing that we're internally reviewing right now. Are we going to continue with that? I think the data from that has been very useful because we can look at, there's three types. There's the demand burden, the stress burden, and then, and I'm so sorry, I forget the third one, but the demand burden and the stress burden were the two that were very important, because the stress that even with publicly or any kind of services and supports that are being provided in the community, it's still not going to take away that stress level of that individual. The way that scale is developed and it's been implemented and utilized. So that burden tells us that those people need things like counseling or education. Some of the stuff that you guys are doing right there at Alzheimer's Catholic Charities is doing with their different programs with Hattie and things like that. So it's important because it shows us where the needs are based on how they score with their demand and stress burdens. Helps us to kind of determine how we want to utilize programming here at EOA. So we're still discussing that through Ian. We haven't made a decision on that. I think it does have a lot of value. I'd like to continue it, and I need to make sure that we can effectively operationalize that in each of the counties that they're utilizing that correctly. And to your second point about the wait list, it is important to be able to determine who is waiting for services. And I think having a more, and we've been actually reviewing that through our Aging and Disability Resource Center operational work group. So that's something that we're working on currently on how we're going to really ensure that we have a standard in place for what a wait list means, so that when we are asked how many people are waiting, what does that mean, and how do you basically, he likes the dial, I have a thumbs up too. How do we respond to the legislature when they ask us that? It needs to be standardized. So that's something that our, we call it our AOW work group has been working on. So something we're still in process, but we are working on.
Great, Caroline. You know, that's one of my big things too, is the data. Could we also have like no wrong door? I mean, if they call the wrong place, that helps link them to where they need to be, or without saying, you know, call someplace else or something like, I mean,
right. And that's part of the processes and systems that we've been developing over time. But I think Diane had a question too.
Yep, Diane has a question. Go ahead, Diane.
Hi, I just wanted to check, Caroline. So is there any sense from the legislature that they would add the additional funding? And if it's not added, how are you going to determine priority for services? Yeah, how are you going to determine priority? What will be the priorities that you folks are going to set on who to serve?
Right. So I kind of know where Diane's question's coming from, because if we don't get additional funding, you have your 9 million that's set aside for Kupuna care in totality, and these programs become intertwined. Where's that scale, right, Diane? Where are we going to determine, is it a caregiver need? Is it just an older adult need? And again, what I want to go back to, it really is based on what that assessment is. And if I think I believe if there's that possibility that that a caregiver is going to lose employment, which would really be detrimental long-term to that caregiver who's going to become an older adult one day and not have what they need. And I'm just saying this, it's not what we're, but I feel that that's would be a determining factor. And really looking at how can we utilize services and supports. And again, we have our Older American Act funds. We've gotten a lot of additional Older American Act funds through the ARP funding, the CARES Act. So I feel confident right now over the next 2 years, we can support without taking away from both older adults and caregivers. Going forward from there, though, is going to be, I think, where we're going to have to really look at our budgets and really determine what do we need to support both ends, both the caregiver and the older adult, and how much money will that require of us, and building the workforce too. We have to do that. That's another area that we need. And I think about 2 years from now, 3 years from now, after we run through our CARES Act money, when we run through our ARP funds, we're really going to have to hone in on what that dollar figure is. And that would be the legislative request in the future. I hope that answers your question.
Okay, thank you.
Thanks, Diane.
So Caroline, very, very important issue. And thank you so much for presenting. Does anybody else have any questions for her?
Rick, I'd like to ask a question.
Okay, Barbara, go ahead.
Being that Kupuna Caregivers was based on a certain amount of money, how will that fit into Kupuna Care, which was not money that the caregiver could get for caring for the Kupuna?
So Barbara, are you kind of like referring to the $210 a week?
Correct.
And
because that's not applicable in Kupuna Care, correct?
Correct. So I see it as really looking at if they have that need, say they need to go to adult daycare. We would really look at that and what does it take to keep those caregivers working. So we have the flexibility of utilizing the resources that we have available to support that.
But if you don't get the funding, which I can't remember, was the last request was for 1.2, 1.5. Okay,
Yeah.
and it didn't come through. How would we support working caregivers? I mean, are we still gonna? Is there still gonna be some? It was for the working caregiver. Now, the Kupuna Care doesn't necessarily have working caregivers, right? And also Kupuna Care recipients need to go through an agency, right?
Well, what they do is they go through the ADRC. So yeah, they go through there to get the services and supports they need. So same process with the caregivers would call the ADRCs.
Under Kupuna Care, most of the Kupuna were receiving money. Well, the money, whoever received it, was for the I'm not.
I know what you mean. It went to the service. It goes to the service providers to provide the services and supports, right?
Thank you, Caroline.
No problem. Again, we have both the option of Kupuna Care on the neighbor islands. We've also implemented our participant directed program, which is an option in Hawaii, Maui, and Kauai counties. Something that we'd like to get started here in the future, because I think that's a great option, especially when it's hard for individuals to be supported, or if there's a lack of maybe services within, we have pockets of areas here that aren't served, right? So that would be an option. And so I think, and Barbara, I'm sorry, now I'm forgetting your question.
But I was going to say, but that's not going to come up. But participant directed services are not an option in 3 of the counties right now, correct? Or,
Well, it's
Or
just the
just-
city and county of Honolulu, but they do have it as an option in the other 3 counties.
okay, I thought that was just for veterans. So that,
Oh, no,
For
we
veteran.
have both. We have both.
okay. So it's veterans on Oahu also, or nothing on
Right.
Oahu?
Veterans Directed is on Oahu.
Okay.
And that they have their own budget from the Veterans Administration. So it
Okay.
doesn't touch any of our funding.
Okay, so yeah, so that was my concern. If the money, the way the logistics of how the money came to whoever it was going to has changed, is different for those programs. How are you going to merge that? How are you going to make that easier? And also, like I said, about hours worked, which used to be, well, it used to be $350 and then it went down to $210. What is the average? Do you know off the top of your head, Caroline, what the average Kupuna Care recipient gets?
Approximately about $1,600 worth of services per year, which of course is a lot less than those that were receiving. Kupuna
$1,600
Caregiver.
per year?
Right. That, again, that's an average, right? Across
And then-
all
and then-
services and support.
And then Kupuna Caregivers was up to $1,400 a month.
That sounds about right. And depending on whether.
$350 a
they-
week, it'd even be
Right.
more than $1,400, but
Mhm.
so I don't understand how you can merge those two things. Those are huge differences to me.
And I think when you look at, I don't want to say behind the scenes because that doesn't sound right, but when you look at it administratively though, I feel the beauty of this is that we have, say you're a provider, say you are providing adult daycare or some other service, maybe personal care. With adult daycare right now, in our current system, you have a contract to provide adult daycare under Kupuna Care. You have a contract to provide adult daycare under Kupuna Caregiver program. If those switches need to be made, there's sometimes delays in services. That's where we get to those efficiencies, where if it's in one contract supporting both caregiver and older adult, we'll be pulling the resources from just that one pot of money. So we can serve people hopefully quicker. They won't have to wait for services. That was one of the complaints of the Kupuna Caregiver program, because we had put some other things into place, such as the employment verification, things like that. Some of those are the things that we're talking about getting rid of in the new program, and just having people attest to being fully employed or at least working 30 hours a week, so that we can get them to services and supports in a quicker manner. So I don't know, Barbara, if I'm answering your question.
Well, you are, Caroline, but when you say those are the things if, for instance, dropping the employment verification, when are we going to learn those specifics? Because those specifics would be important to know for us.
And that's what it's, again, those were in our guidelines. That was developed under EOA when we launched the Kupuna Caregiver program. It's not in statute, but we were just trying to do our due diligence to make sure that these people were employed. But, I think if we can, whether it's just an attestation that they're employed, I think that will suffice.
Okay, so again, that was, that's my question. That's different in the programs, between the two programs. So
Right.
when will we learn what these specific things are going to change to make the efficiency that you talked about and the merging of the programs a good thing?
So we have to see if it's going to be accepted
Okay.
as a proposal, and then we can work on, amending those guidelines, deciding what we're going to keep, what we're going to take out. We have some ideas, and then we'll watch the legislation as it goes through the process. This would all take effect, obviously, July 1 of next year. If, it goes through, everything, becomes law, then, but in that time period between now and then, we're going to start planning, revising our guidelines, and doing what we need to do to get the program succinctly merged.
Okay. One last thing, Caroline, a comment is that I fear because the 1.2, 1.5 was not awarded last year and we're muddling through, that there would be no reason for the legislature to give it this time, especially if we're combining the programs. I think they'll see that as well, then why do you need this money? That's just my negative feeling toward our legislature.
And I understand where it's happened. I mean, it happened the last year, right? When we didn't get the monies. And I echo your concerns.
Okay. Thank you very much for answering all those
garbled
questions.
Barbara.
Appreciate it.
No, I appreciate you too.
Aloha.
All right. Thanks, everybody. So we have one last question on this, then we're going to move on to Sam. Sam Trad is here now. So Kathy's going to ask one last question, and then we'll move on. Thank you.
Going to be 2 halves to 1 long question.
Keep it short, Kathy.
Caroline, okay, so this wouldn't happen until next July. So there's enough funding in Kupuna Caregiver right now to last until then?
I believe so. I think things are picking up again, as people are getting vaccinated, but I haven't run the numbers in the last 2 months, but I can't. Give me a chance to look at that and see where we're at.
I think Joel said there was.
I think there is. I just need to. I'm just guessing from what I looked at within the last 2 months that we'll be okay till then.
I think he said if they run out of those funds, they will use Kupuna Care funds for it. The other half of this very short question, Rick, without asking for 1.5 million in your gut, how positive or negative are you that they will pass combining the 2 programs?
I'm hopeful. I think it makes sense. I think government's looking at how can we efficiently do things smarter, better, and I'm hoping that this proposal is seen as that.
Okay, good.
As far as 1.5, again, that's been asked. So I do have that as an ask. I have 2 asks this legislative session. That's one of them. The other one's for the long-term care ombudsman program. But so those are my one ask is that 1.5. We just have to see if that's picked up.
Okay. So if we ask for the money, they don't give us the money, but they could combine programs regardless.
And that's where I think some of the concerns are coming from too. It's like, how are you going to spread your 9 million now between these 2 programs? And I echo those thoughts too. We'll just have to be, I think, creative in strategies.
Yeah. My biggest fear was they were talking about dropping the Kupuna Caregiver program, which is really disconcerting because I have a lot of clients that are on that. So I just wanted to give you my 100% support. And if that comes up for testimonies, you guys, everybody on this page should be jumping in and testifying how important it is for the caregivers to be able to be included in the program.
Yeah, both programs very valuable, definitely. Okay, so thanks, Caroline. Please stay on board. Maybe questions later here.
I'm going to turn my video off, but I'm here.
Yeah. Okay. So next up, same format, 15-20 minutes. If you have questions, go ahead, put them in the chat. We'll ask them as when we get to the end here. So we have Samantha Trad here. So as I said, Compassion and Choice. She's the Senior Campaign Director for both Hawaii and California. So welcome, Sam. Thanks for joining us.
Thank you so much for inviting me and making time for me today. Aloha, everyone. I'm going to talk a little bit about our bill, why it's so important, and a bit of an overview of the Our Care, Our Choice Act. And I'm not sure how familiar everyone is with all the details. So if I'm talking about stuff that you already know about, please let me know. But what I want to start off with is, our organization, Compassion and Choices, we helped write Oregon's law back in the 90s. And when we wrote Oregon's law, we made sure that there were plenty of safeguards in it. And what Oregon's law is what all of the other medical aid and dying laws are modeled after. So if a person is terminally ill with 6 months or less to live, and they're mentally capable of understanding their medical decision, so this is not an option for somebody with advanced Alzheimer's, and they're able to self-ingest the medication, they can have the option, or they, at least in Hawaii now, they should be able to have the option of aid in dying medication. Now, this is an option for people who are imminently dying. And the people who choose medical aid in dying do not want to die. The reason they choose it is because they do not want to suffer at the end of their life, and they don't want to go down the course their terminal illness has for them. We know from data, we have lots of data from all of the departments of health where aid in dying is now authorized, which is 10 states and Washington, D.C. We know that about a third of the people who go through the whole process in order to obtain a prescription don't even take the medication, but just having it gives them a huge sense of relief to know that it's available to them. So I can talk all day about medical aid and dying laws, why this is so important, but I really want you to understand that this is for people who are imminently dying, and it's been around since the 90s. In fact, we have about 60 combined years of data from all the departments of health, including Hawaii. So Hawaii passed their medical aid and dying law in 2018, and it went into effect in 2019. So we have about 2 years of data. And right away after the first year, the Department of Health had a summit with all the medical providers who had worked in this law to support patients to find out what's working, what isn't working. And it was very clear that a lot of people cannot access the law. In fact, Hawaii has the most difficult law to access of all of the 10 states in Washington, D.C. And the new trend is to amend the laws. Oregon has amended their law because one of the steps, and in Hawaii, it's actually a 15-step process to access the law. One of the steps is a 20-day waiting period between 2 oral requests. So we have little booklets to help. Just imagine, I mean, when you're diagnosed with a terminal illness and you have 6 months or less to live, everyone usually tries to do everything they can to extend their life, to see if they can overcome it, to survive it if it's cancer. Most people have cancer who choose medical aid and dying. But when it's clear that they're not going to be able to extend their life, then a lot of people want the option of medical aid and dying. And most people have no idea that there's such a cumbersome process that they have to go through in order to access this peaceful dying option. Now, in the way it works is you have to have 2 different doctors confirm your terminal illness, that you have 6 months less to live. In fact, the main prescribing doctor has a whole list of things that they go over with the patient. That's very important. Then there's a second doctor that confirms the patient's eligibility. In Hawaii, there's a mandatory 3rd mental health assessment to make sure that the patient is not suffering from depression that hasn't been treated, and that they do fully understand the decision that they're making. Now, the main prescribing doctor, they have to ask 2 times, and it's separated by a 20-day waiting period. Now, most other states have a 15-day waiting period, and now both California and New Mexico have a 48-hour waiting period. This is really important because what we found, we have data from Kaiser and from Hawaii Pacific Health that about 30% of their patients die during that waiting period. And it's almost worse than if there was no medical aid and dying law, because people think that they're going to be able to have this option, and then they die in exactly the way they don't want to during the waiting period. And this is really traumatic for the patient, as well as for the medical providers who are trying to give this patient a peaceful end of life experience. And so what Oregon has done is they allow the prescribing physician the ability to waive the waiting period completely. And like I said, California just amended their law to reduce the waiting period from 15 days down to 48 hours. And New Mexico just passed their law, and they have 48 hours because it's clear it's such a long process. There's so many really core important safeguards in the law, and it's clear that the waiting period is not a safeguard. It's just a suffering period. It's a barrier that prevents people who are dying from accessing the law. And even people who survive that waiting period talk about what a horrendous time it is, wondering if they're going to survive that 20 days. They're on edge. It's not how anybody wants to spend their final few weeks on this earth. And so the Hawaii Department of Health, after the first year the law was in effect, they recommended to the legislature that the legislature do three things. One, reduce the waiting period. Two, allow the prescribing physician the ability to waive the waiting period if the patient's unlikely to survive it. And three, allow advanced practice registered nurses who are qualified with prescriptive authority the ability to support patients in this option. It's actually already in the scope of practice for advanced practice registered nurses, and there's about 1,000 APRNs who would be able to support patients. So it's already difficult to find a doctor for, to schedule appointments, and it's even harder to find a doctor who can support you in aid in dying. And there's a few reasons for that, which I can go into, but the solution the Department of Health found with all of these medical providers who've been supporting patients is to make those three amendments. So that's what our bill does. The bill was first filed in 2020. It passed out of the Senate with flying colors, and then the COVID-19 global pandemic hit and it got stalled in the House. So we tried again in 2021, but now, there's new House leadership. And so we've been working with them to try to help them understand why this is so important. Again, it flew through the Senate overwhelmingly and got stuck in the House in 2021. And what I'm really worried is, or what I think we need is we need to help the House members understand why this is so important, because I have a really bad feeling that a House member is not going to make this a top priority until a loved one of theirs has a horrendous death and is not able to access the law. Diane Rehm has a great documentary out about medical aid in dying, and she has a famous quote where she says, "Everyone is one bad death away from supporting medical aid in dying," and no one should have to go through that. And I have a booklet I can send you about, people in Hawaii who've used this law, people who wanted to use the law but weren't able to. And there are many physicians, nurses, social workers who are very, very supportive of the law because they understand that we're all going to die. But if we can write our last chapter, it's such an incredibly important and beautiful thing that affects all of us. And actually, it's not as important in Hawaii, but this is a bipartisan issue. It's supported by people from every walk of life. Even the majority of Catholics support it. The only opposition we have is the Catholic Church itself, but Catholics support medical aid in dying the same as everyone else. So our bill is really important because there are people who are dying, who are suffering, who are not going to be able to access this law, especially on neighbor islands, but also on Oahu. We get calls almost every week from people who are dying, loved ones who have loved ones who are dying. They desperately want this option and they cannot access it. So the law is not working as intended because people cannot access it. And that's why this bill is so important. It's a improvement bill. It makes smart amendments that are supported by data, and it will remove barriers so that more dying people in Hawaii will be able to access this peaceful end of life option.
Yeah, it's it's not for everyone, but for the folks that really need and try to access it, it's just so important, and to their families as well. So do we have any questions from anyone? Oh, okay, Ian has his hand up. Ian?
Sorry for not being updated on this, and I was also moving around for a moment, so you may have mentioned it. So since the bill was passed, I believe in 2018 originally, the Our Care, Our Choice Act, have there been amendments to extend access at all? Any bills that have passed at all have changed it?
Actually, so there was one bill in 2019 that amended the pharmacy bill, the pharmacy law. So specifically for aid in dying medication, a patient doesn't have to pick it up within 1 week. They can wait 30 days before they go and pay for it. Because if they decide not to use it, then they don't want to have to pay for it. And since they can't leave it at the pharmacy for more than, they need to be able to leave it at the pharmacy for more than a week. So that is one amendment that was made.
Okay, great. So it helps me understand that this is more as a continuation in a series of amendments to improve the bill, as opposed to like coming back with something rather large after many years. So thank you for helping me understand the sort of nature of the changes over time.
Yeah. And to that point, I want to make sure everyone knows we're really open to these amendments. This is what the Department of Health has recommended. I know in California, originally the amendment was to have the prescribing physician be able to waive the waiting period for everyone. But the medical association actually said, you know what, if this is a problem for everyone, let's just reduce it to 48 hours for everyone. So no physician has to make that call of whether or not the patient will survive 15 days. In Hawaii, it would be 20 days, right? So, we're very open to working with House members to make sure we have a good bill that improves our Care Our Choice Act that everyone feels comfortable with.
Okay, thank you. Any other questions out there? All right, so such a valuable just peace of mind, piece of legislation and going forward. So, okay, thank you, Sam.
Thank you,
Really
Rick.
appreciate it. So next up, keep your hand up there, Ian, you're up. So Ian Ross, Alzheimer's Association, Hawaii, I call it Aloha Chapter, Public Policy and Advisory Manager.
Thank you so much. Give me 1 second. I'm going to start sharing my screen. Can everyone see this okay?
Yep.
Excellent. All right, well, Rick, thank you very much for the introduction. As mentioned, I'm the Public Policy and Advocacy Manager for the Alzheimer's Association. I just hit 3 years, and it's interesting to think about because now half of the time has been during a pandemic. So it gives me at least a little bit of the time to hit the ground running. I've talked to people who started like the first month was during the pandemic. So we had some before and after kind of like ideas and understanding of how to move forward. 2020 was, of course, an incredibly difficult year for advocacy. I think we hit the ground running again in 2021 with the legislation. So I'm going to start with a bit of an overview as to why Alzheimer's disease is a public health crisis. I think it's a great reminder. And then I'm going to go a little bit into what we were working on the last few years and then how that connects to what we're looking at in 2022. So Alzheimer's disease, as I just said, is a public health crisis. It affects 29,000 people over age 65 in Hawaii, and 1 in 3 seniors who pass away in the United States do so with Alzheimer's or another dementia. So they pass away with it, not necessarily as the direct cause. It is a profound impact on the 51,000 family members who provide 81 million hours of unpaid care to their loved ones. When you talk about economic activity, it really relates to things like sales and services. We don't consider things like caregiving, but if we did put a valuation on it, even just a low valuation for the value of that labor, it would be about $1.4 billion in Hawaii, which is an enormous amount, making it a rather large industry in Hawaii. Family caregivers often suffer their own health crises, as well as financial crises and other stress. Also, the New England Journal of Medicine reported, this is before the pandemic, that Alzheimer's disease was the most expensive disease in America, surpassing both many forms of cancer. Costs are still skyrocketing. These costs affect things like Medicaid, Medicare insurance, individuals, and going into the caregivers. Most of it falls into Medicaid, but there's a huge amount of it that just isn't really accounted for as like medical costs due to the nature of Alzheimer's disease. So that's where it falls onto individuals and their caregivers. And caregivers are facing enormous challenges in fully rejoining the workforce during this pandemic. Just like parents, caregivers also have a lot more stresses and considerations during this. Moving on. So there is a plan for making Hawaii dementia capable. So there was a state plan developed through the Department of Health in 2014. The plan recommends a task force and had recommendations from task force rather of more than 40 community and government stakeholders, and the recommendations related to prevention treatment by 2025, care quality, expanding support and training, respite, legal, financial, safety, awareness, data collection, monitoring. It's a big plan, had a lot of great ideas, really is a fantastic blueprint. Unfortunately, limited progress has been made, and a lot of legislators and government agencies and departments don't know what's in the plan. Now I'm going to make the huge exception here. Executive Office on Aging is really on top of it. They do understand what's in the plan. They are continuing to work off of the plan. Doesn't change the fact that the state hasn't done enough, but they are an important exception here and a terrific partner as we're working towards this. Work has already started on a new state plan, and that's, when we have so little progress in the previous one, there is a bitter sweetness to that, but there are important changes that can be made and updates that will be made going forward. If someone here isn't in the work group and you think you'd be a great addition to the work group, I would definitely private message Caroline right now. But I think the overall thing to take in mind here is we can't just wait for the new state plan and the new recommendations. We have to be working with what we have right now. The plan is supposedly good through 2025. It's a 2025 state plan, and we should continue to work off of those recommendations. And that's what the Alzheimer's Association aims to do. So when we talk about state advocacy, the Alzheimer's Association has long played a critical role when you're talking about Kupuna and especially dementia. Since 2013, we've been active in the development of that state plan I just mentioned. It came out in 2014. We were working before then. We also hold annual Advocacy Day events to promote awareness of these issues and the state plan. I give a summary of the state plan to basically every legislative office that I can to remind them every year of what's in there and why it's important. So we've had a range of things we've advocated for. The state Alzheimer's coordinator position, we're working on that since 2014. I'm really happy it was included in the budget this year. Before it was 2014 to current when I last reported to you folks. Now it's to 2021. So I'm so happy that it's there and that it was included. We have a picture with the governor in 2019 when we first passed a bill related to it. Unfortunately, there were issues with that legislation and it didn't allow for that establishment of the position, but now we're moving forward on that. We also advocated for a pilot program to expand dementia training for Native Hawaiians. That didn't go through, unfortunately. We had an ambitious Alzheimer's legislative agenda with 6 different bills, and we actually got 5 of them to cross over. It was a lot of energy towards that. And then the pandemic hit, and none of the legislation that we were supporting passed. The bill which didn't cross over, the one that was the weakest bill, would establish training requirements for first responders. That's actually the one we picked up this year and continue to work on it. Originally I had APS as well, but we removed that at the time. And we passed a bill which established dementia training, but didn't require it. And we've been working on county levels to begin pushing them to require it. And we're going to go on the state level again and continue on the offensive and try to make sure that first responders know how to recognize and properly interact with Kupuna, with dementia. I say Kupuna, but actually also younger onset, which is one group that often has some of the worst challenges when they do interact with the police. And we might want to be revisiting the APS as well. I'll be bringing that up in a moment. So here we are on the recommendations for this year. So we have these 4 goals that we focus in on in every state: increasing public awareness, early detection, diagnosis, building a dementia-capable workforce, increasing access to HCBS, and enhancing quality of care in residential settings. So those are the goals that we want to be working on. Pardon me. So right now, after what Caroline was talking about earlier, we are in support of that idea of combining the Kupuna Care and Kupuna Caregiver programs. I think that that seems like a really strong way forward. There's a lot that's there. You know, I'm going to keep asking hard questions about like tracking and making sure we have the right metrics, because I do feel like these programs need to be expanded in a lot of ways. And, you know, long term, just keeping at the size they are might not be the thing that we want to be aiming towards long term. However, it's a fantastic direction that puts all the pieces together right now. And so it's got our full support. So we believe that this is a good idea. We really like zooming in on one of the measures that we've been pushing for several years, which is the potential for lowering the work hour requirements from 30 to 20, and hearing from the director that the red tape and like maybe attestation of working might be sufficient, and making things simpler for people to get in. That also sounds like really good news. So we want to explore that. That's not something we're going to draw a hard line on or anything. I respect what the agency finds, what that equilibrium needs to be between the competing concerns. But I think things are indicating that they're going in the right direction. I'd heard before 8.5 million. I came in a little bit late to this meeting. My last one ran long. I'm sorry. I'm not sure if that's still the standard, but we are in support of that. Something else, required dementia training for first responders. We believe that police officers, firefighters, EMTs should receive regular training. I'm going to be meeting with like leaders across the state the next few months to find out what that is. I'm hoping we have one standard. I'd be accepting of an hour when they first join before they ever work, and then an hour recurring each year. Police and firefighters seem to have recurring annual training. EMTs are a little bit different. So if that ends up being once every 2 years, I don't think that's weakening it so much that it's not useful. I think that could still help a lot. Some people might be wondering, these are really well-trained professionals who understand manage like disasters and things of that nature. They probably know enough already. That hasn't been the case in a lot of people's experience. We had 10 present and former caregivers talking to the Honolulu City Council when they were passing an initiative related to this bill and pushing the city administration to implement these requirements. And there were just so many stories of, here are some really fantastic professional first responders who come into a circumstance and are basically blind to the specific needs. And it's not because they aren't experts and professionals, just this is an area where training hasn't been good enough. And we heard from the leaders of Hawaii, Honolulu Fire Department, Honolulu Police Department, and the EMTs here saying, this is something we support. And stakeholders were a little bit lukewarm on this at first, but everyone's coming around to it. And I hope the Kokua Council supports this as well. I think it's a great idea. We want to come back to something which had been around as one of our bills in 2020 as well, which is one of the things that shot down this bill initially, which is requiring for adult protective services as well. So the way that training for adult protective services could go is a little bit different than other like first responders, because they don't really fit that category. It should be geared more towards identifying safety and abuse risks and making sure they know how to provide the right types of support. They should feel confident when they're interacting, and that's some basic understanding about dementia. Dementia is really unique compared to other diseases, and the situations it creates can be unique. Very few things besides maybe being a caregiver yourself could fully prepare you, but also every dementia experience is unique as well. So being a caregiver in one circumstance might actually make you not fully aware of the other types of circumstances that can be caused. It's a good foundation overall. There's some good basic knowledge. And so in that way, comprehensive training is the way to go in our view. So these are the real big initiatives here. We want to split them up as different bills. We don't want one being a little contentious shooting down the other. And I've been reaching out to Department of Health and other organizations, Department of Human Services. I still haven't had a good chance to talk with Adult Protective Services yet. So you folks are getting it first, but this is something which we're working towards right now. So other things we're looking at. So these are things that aren't quite bills yet, but I'm having conversations regularly with legislators. Expansion of access to Medicaid waivers, specifically Medicaid Section 1115 waivers, which enable family members to provide care in like at-home settings. It can reduce the demand for more expensive care, which means it can provide cost savings for individuals, provide cost savings for the state. It's often also in keeping with the idea of aging in place and aging at home, which we know a lot of Kupuna really do prefer. Keeps families more together, which can be great. It also is especially helpful in rural settings where care homes might be very far away on neighbor islands and certain parts of the island. Many states just see this as an important way to support caregivers and reducing costs. So something to do with expanding access. Is it increasing the amount of reimbursement? Is it reducing some of the red tape? Is it increasing the pool of people? Those are the kinds of things we're examining. We just want to make sure we have this tool in the toolkit is well resourced. We're also looking at improving training pipelines. I've had conversations with HAH. I've had conversations with Representative Tam. We're looking at ways to improve incentives and career pathways in healthcare, especially those who specialize in gerontology, geriatrics, and different types of nursing care. The nursing one's particularly interesting one, as I'm hearing there's real problems with the nursing pipeline in Hawaii right now due to like the types of training programs. Because this isn't fully formed, I'm not gonna 100% dive into it, but if anyone here is interested, this is fertile ground for collaboration, and I wanted to put it out there. And if someone else is presenting and working on something on this first and wants to be the lead, the Alzheimer's Association, depending on the specifics, might be happy to come in as a strong partner on this, letting you take the lead and us bring the force of our advocates and resources to bear to help you out. A few other quick thoughts on what we do for advocacy. We use things like phone to action, where we may try to make it easy to get on your phone and quickly send an email to your legislator or set you up on a call. We used to be able to do testimony through this. The legislature has moved far away from allowing that to happen, but it was a fun way to get several dozen testimonies in 24 hours while it worked. But we probably will be sending like reminders to submit testimony, to check your email, to walk you through it. And it's just a really important way to help out without spending much time. So if it's something you're interested in doing, please take out your phone now and text Al's Walk to 52886. It is not case sensitive. Follow the text prompts. It's going to ask you for your email and your zip code right there texting. You don't have to follow the link. It will get you signed in into our system. You can also email me at iaross@alice.org, or just give me a call on my cell phone, 652-3380. But now, of course, you do have to include the 808 with that recent change. Share your story with me. Tell me your idea for a law or a program. I'm open to it. We still have a few months left, so there's still some time to get our footing. We had 4 goals that I mentioned. If you have something which we weren't working on that you're really interested in, passionate, and knowledgeable on, tell me about it. I'm really happy to hear about it. All right, I'm happy to take questions.
Okay, any questions out there for Ian? Thank you, Ian, for your presentation. We always appreciate it. Folks have questions? I have just one. So it's kind of the legislation that 3 years ago you guys originally worked on and passed. What is happening with the coordinator position at this point for Alzheimer's?
Well, it's a really great question. I would happily defer to the director of the Executive Office on Aging if she prefer to answer, but if not, I can answer.
Oh, Caroline, right, you're here.
Yeah, I'm still here, Rick. We're still working on that through the internal channels because it has to be established just like any other position within the state. So that is a daunting task, I will say. It goes back and forth. You know, they got to make sure that it follows the standard template and things like that. So, you know, we've been working on that and it's in review right now.
Okay. Is there anything else needed from any of us around that, or is it?
No, it's mostly internal Department of Health stuff.
Would it help if we just set up an email campaign for the director of the Department of Health or the governor? I know you can't say yes, but blink twice if this would be helpful. I'm just kidding. But, you know, we're really happy to try to help out.
Okay. Any other questions for Ian? No. All right, Ian. Great job as always. So last but not least, our good buddy, Gary Simon on AARP. Take it away, Gary.
Hey, thank you, Rick and Lila and everyone in the room, in the Zoom room. Let me provide some context here. They're on Hawaii Saves, a retirement savings program. It's AARP Hawaii has been carrying the flag on this for about 5 years now. There are over 200,000 employees, mostly in small businesses here in Hawaii, that don't have access to an easy retirement savings program. The legislature has been resistant to implementing a state-sponsored retirement savings program. So where we ended up was with a study to study the viability of establishing a public-private partnership for retirement savings. Employees are 15 times more likely to start saving, establish a retirement savings program, if they have easy access via their employer, automatic payroll deduction. The model program right now is Oregon Saves, which has been in operation for about 3 years now. They now have $100 million in Oregon Saves. And the average contribution is about $50 per paycheck, about $100 a month, again, for small businesses. The enabling legislation this past legislative session was Senate Resolution 76, which provided for Hawaii Retirement Savings Task Force to study whether such a plan is viable. Should we move ahead and to provide recommendations for a plan? The task force began meeting in September, and we're hoping that that there is a viable plan out there. One option is to piggyback with existing plans. Illinois has a plan, California has a plan, New York is beginning to ramp up their plan. But again, the most successful plan that thus far, the one that has gone furthest down the road is Oregon Saves with their 100 million. Hawaii has many crises, and one of the continuing crises is retirement savings. So we all need to do better and give employees who don't have access to a retirement savings plan, and most of them work for small businesses, access to an automatic payroll deduction. And then again, you're 15 times more likely to save. And when you aggregate that over your career, whatever it is, maybe you can't save $50 per paycheck. Maybe you can only save half that, $25. Maybe you forsake forsake 2 lattes from Starbucks, or if you can, whatever you can forsake, but save it over the long haul. Savings by, any financial expert will say slow and steady wins the race. Any questions? Thank you, Rick. Thank you, Lila. Go ahead, Caroline.
Caroline, yeah.
I had a question. I'm sorry, I couldn't find the hand thingy, but my question was, is the idea, and I should know this better, but is the idea that somewhere within state government, they would be sort of the administrators for this retirement?
The launch comes from the state. The initial funding comes from the state. And then as the assets build up, the private fiduciary starts paying back that seed money.
Got it.
And that's what Oregon is doing.
Okay.
It's the buy-in, costs nothing. Necessarily costs something, but state will be reimbursed. And there is state oversight too.
Great. Okay. Thank you.
Thank you. Ian?
So one thing that always confused me about this is it's just such a obviously very smart idea. It brings the right types of resources together. It doesn't, I mean, it's complicated to some degree, I'm sure on the back end, but like on the front end, it's simple, it works, all those things. What type of pushback are you getting back from legislators and business, like specifically? I understand
It's one of the rationales. It's a very what do you say? It's parochial rationale that people can't afford to save. Some legislators already pigeonholing people and saying they're too poor to save. That is, it's not their place to say that. Their place, the legislators' place is to provide the opportunity, not to project their judgment across the community. That's been it. And then there was the startup funds. Some of the legislators said there's no startup funds for this. Not arguing the part that the state would eventually be paid back, just that there's no seed monies, period, for it. But it's the proverbial, if not now, when. Does that help, Ian?
It does. It just, I don't know. I'm sure for you too, so I'm not trying to get you to argue their side. It just seems like such a weak argument from their part when you compare it against the benefits.
It is, but you know, Ian, you see parallels all over, especially in your endeavors, Ian. It's like, what am I dealing with?
Well, I always feel like when I'm advocating some sort of like red tape in terms of, well, if we do it that way, this confuses things down the line. I can kind of see their point of view. I argue the benefits, but I don't know, you have so many knockdown additional benefits. So I'll leave it there, but it kind of confused me because I'm trying to put together as a former debater, what's the counter argument? But the counter argument seems to just be what you're saying already.
Yeah, there is an 800-pound gorilla in the room of life insurances and banks thinking that Hawaii Saves will take away savings, well, their assets. But people aren't saving anyway, so they're not taking away their any assets. Some life insurance and then some financial planners say, well, there are already vehicles out there for people to save, IRAs, even the run-of-the-mill bank savings. But savings hasn't improved over the last couple of decades, right? IRAs have plateaued across the nation. So there is that force. Some deep pocket businesses don't want competition. Yeah. Any other questions?
You know, I'm concerned because if they are saying Social Security is in jeopardy and people can't get a retirement kind of program of any kind of savings together, what does the future hold? You know, I mean, I think to my in-laws, you know, they were laborers all their life, but they had retirement plans which carried them to the end of life that we don't have. Many of us don't have. Some do, but many people don't have access to, especially our caregivers that we're talking about here. So keep the fight on, Gary.
Okay, thank you. Thank you, Rick.
Supportive. Any other questions from anyone? Oh, there's two chats. What are they? Real quick. Okay, so Ian says that there's an issue with the phone to action link. Please text AIM walk to 52886 instead. Correct, Ian?
I tried
Okay.
that, Rick, and it didn't work.
So yeah, it's, as I said, not owls. We had two up. It looks like one went down since last week. AIM walk, AIM space walk. And then it will ask you, what is your email address? And you respond with your email address and ask you for your zip code. And that's just so we can line you up with your federal legislator in the future if we have a call to action, or even your state legislator. Okay.
What it said for me, it's invalid number.
Can you read the phone number back to me, please? 1-216-116-11. So the phone number you'll want to text is 52886.
Okay, my mistake. Thank
No
you.
worries. Yeah, it happens all the time. People are still aren't fully used to this type of technology, and it gets confusing which one. I've definitely told people 52286 before and mixed up which one's the double. So it happens to all of us. All right, thank you.
Okay, so this is, like I said, part 2 of the legislative priorities. Part 3, we're hoping to have the legislators come join us. And we want to encourage you guys, as all of you are involved in this, as keep us posted at Kokua Council, the measures, especially provide the House bill or Senate numbers as they're introduced, so we can stay on top of them. John, we're definitely going to support you as well and what your needs are. So there's some really important bills that we're actually trying to support. And I feel like we've been, and you guys are on board, we've been delayed by this pandemic a couple of years. So this year is especially important. So we're really spending some time on this to try to sort out what needs to be supported, which is all of this and many other things as well. Doug's going to kind of clean up this video here and get us a link. We'll send it out to everybody that's been here, and we just encourage you to kind of post it and send it to folks. And I really want to encourage folks to join us again on November 22nd same time, same place. So 11:30 to 1 o'clock for the next Kokua Council Forum. And who knows, we may have you guys speaking again. We'll sort that out as part of the board here and just really move to the next level. Again, we're just really trying to support our legislators and getting the best possible bills written in the best way possible so we can try to help, move these things forward for our Kupuna. So appreciate it, everybody. Thank you. Have a good day.
Thank you, Rick.
Aloha.
Yeah, have a great week, everybody.
Happy Halloween.
Yeah. Rick's searching for that great pumpkin, with linings.
Every year.
Sorry, Lila, I saw you sent a message earlier about support. Thank you so much for that.
Thank you, Ian. See you again. Thank you very much, everyone.
Rick, great job. Take care, everyone.
Thanks, Ian. Appreciate seeing you again.
Thanks, Rick.
Thanks, Lila. You get better now. This has gone on
I
too long.
will. Thank
Huh?
you.
Anything I can do to help?
No, but thank you. I'm going to stop the recording now.
Okay. I'm going to take off.
Okay.
Take care. Be
Thank
well.
you.